Please welcome Dr. Yogesh Niturkar.
So good evening. I am the last batsman. Opening was very wonderful. Middle order has also played very well. Now it is my free hit. Okay? And I won't disappoint you. So I hope all of you are with me. Just cheer up. Yes, thank you. So my topic is what homeopathy can offer. So hello. I hope I am audible. Huh. So my topic is what homeopathy can offer in clinical practice, a case-based learning module. The introduction that she had given, it is only because that I am still a homeopathic learner. And my teachers have taught that it is a lifelong journey that one has to remain. If you want to practice homeopathy, then you have to be a lifelong learner, so that only you will be able to take care of knowledge, you will be able to take care of learner, and you will be able to take care of the patient also. Next. So the objective, iske pehle, next, earlier one. So the objectives of my presentation are to demonstrate scope of homeopathy in advanced pathological conditions that was in the brochure, and that was decided that we should have these objectives. So we are trying to explore the frontiers, homeopathy's role in advanced pathological cases. Many of the cases that we had seen throughout the day, we had been able to witness the success stories of these cases. So integrating modern pathological insights with traditional homeopathic principles, case presentations showcasing successful homeopathic solutions in advanced pathology. Next. And I think this was only possible to have, uske pehle, one more slide, one more, back. Huh. So again the platform is because of these two great ladies, VP SSMS, and I am very much obliged to them. Because of them we are organizing this event. So no weapon can cut the soul into pieces, nor can it be burned by fire, nor moistened by water, not withered by the wind. And because of that, the soul, the energy has transformed into another form, and we are able to look out the energies that that has been enlightened because of these two great ladies. Next. Next. So I request that this is a patient sensitive data, that is why I had not shared the PPT on email also. So please don't take photo or any sort of video shooting. So next slide please. So in this case, homeopathic case management based upon evidence, case taking, telemedicine, then the case processing part, prescription, outcome assessment, and the research perspective that we are going to witness in this case. Next. The working principles that we are having, now I am going from concept to case. Concept to case, and earlier Krutik Shah sir has demonstrated the practice to concept or case to concept aspect. So we are going to see all these aphorisms in the, means the working principles are these aphorisms without which it is highly impossible to practice homeopathy. And Krutik Shah sir has already discussed about these various aphorisms. I won't go into that. Next slide please. So this was a telecommunication that occurred in 19th of April 2021, where the teleconsultation was made by one of my patient for the initiation of treatment of her younger sister. The mode of communication was WhatsApp message, and there was an image that she had sent, and with some question that we had on phone. Next. Now this was the image. And instantly, as 11 to 12, I am having free time in my college, and during that time I just went through the message and I saw, and I instantly after looking I was very much in pain after looking the image itself, and I instantly called, and I wrote it, replied in way that call back, आपका phone नहीं लग रहा. Next. So she called up, doctor क्या आप इसे ठीक कर सकते हो? Doctor, can you cure this? I replied that कोशिश करता हूँ, पेशेंट को फ़ोन करने के लिए बोलिए. I will try, please tell patient to call. So this was the introduction. Next. So whatever discussion we had related to the case, patient sister in Latur recommended her for homeopathic treatment. So this is a 50 years old female, housewife, mother of 2 children, belonging to a rich family. Her husband is a reputed businessman in Pune. From students' perspective, what points we had covered? We had covered who has referred this case, preliminary data in terms of name, age, gender, occupation, marital status, husband's occupation, children, and the socio-economic status. Next. Now what are the chief complaints? We had seen the image and we are pained with that image because of our sensitivity and the severity of the disease. Now the complaints are severe itching and eruptions at groins and genital region since 1 month. Severe discomfort and burning at genital area. Patient is anxious and worried about his complaint as it is not under control. For above complaints, patient had consulted her diabetologist, gynecologist and took treatment from 2 dermatologists. Now again it is a challenge for homeopath to deal with such cases where there is no cure, and as Kishore Mehta sir yesterday also was saying that in terms of prognosis, or today also he focused upon the aspect of prognosis, that we should not go into that, we should just go on whatever data is there, we should build up a totality in terms of evolutionary totality and we should go ahead with the prescription. So same thing, he is teacher of teachers and he was examiner for my MD exams. So already what he had presented yesterday, and I instantly said that this will be in my presentation also because of the master that is in front of me. So we had covered in this location, sensation, modalities are not available, concomitant is there, anxious, worried about complaints because they are uncontrolled, history of treatment is there. Next. Now associated complaints, heavy menses since 2 cycles, severe abdominal pain was there. Since skin complaints, obviously the area that is there which is affected during menses, it will have aggravation. So we are having skin complaints aggravated during menses, it worsens itching, burning and discomfort at genitalia. Period is continuous for around 8 days. Fresh blood with clots. She had took allopathic medicines from gynecologist and dermatologist, but nothing is working. So again what we had covered menstrual history in terms of duration, flow, character, modalities and the concomitant. Next slide please. And on the left side you might have seen the prescription that she had sent me. Along with that, I hope all of you are with me. Hello? Increased cholesterol level since 3 years and diabetes mellitus type 2 since 20 years. She is having 50 years of age. That means she had diabetes at an early age, 30 years of age. And now she is having dyslipidemia also. She is taking oral medicines for cholesterol disturbances. Diabetes and insulin injection is going on. Diabetes is uncontrolled. We have covered points like past history as well as the treatment history, so that we will be able to correlate these things with our fundamental miasm. Okay, that what Hahnemann has mentioned in the 5th aphorism. Next. Now patient as a person. Stocky built, obese, fair complexion, calm disposition, anxious about her health. She had strong fear about her strict mother-in-law. In spite of being at the age of 50, she had still fear of mother-in-law. Dog, darkness, easily takes on stress and becomes anxious, lack of confidence, sedentary lifestyle and perspiration, general, profuse, stool, occasionally unsatisfactory, urine normal, menses we have mentioned, and the thermal status, like sir also mentioned that whatever status is right now we should go into that. Initially she was chilly, later on she had become hot, so we will take as it is. Next slide. Now these are the prescriptions and how we have to go through the prescriptions in terms of understanding what kind of medicine had been prescribed. And my emphasis should be as a homeopath that whether these medicines, means like whatever antifungals are there, 2 antifungals, 1 antihistaminic, anti-allergic, that means my medicine should also have these properties so that it will cure the problem. When I am looking for a remedy, it should have this kind of sphere of action, or it should have this kind of antagonistic action over there. Next, so the diagnosis, one more minute. So the diagnosis made by one last slide. So the diagnosis was tinea cruris by the dermatologist on 5th of March. The diagnosis was tinea cruris. Next slide. Now the second diagnosis made by the consulting diabetologist, that it is something which is needing antimicrobial treatment, and he had prescribed along with the this one anti-lipid medicines, or along with the anti-diabetic medicines, he had prescribed antimicrobial treatment like Surface SN, okay, and multivitamins as well as the antioxidants were prescribed, okay. At that time the HbA1c was 10.3, that was noted on the prescription, okay. Next please. Now the consulting obstetrician, as earlier also I had mentioned, that she had menorrhagia, and because of that the complaints, skin complaints were aggravated, and that had led to the aggravation of complaints. So Primulate N Trinoiam, which is usually prescribed for various menstrual problems, including painful, heavy or irregular periods and premenstrual syndrome. Next please. Now the next prescription is of another dermatologist on 12th of April. Still the condition is not under control, and now the prescription was made of this dermatologist, where the diagnosis was made of candidial vulvitis. Earlier tinea cruris, now candidial vulvitis is the next diagnosis that the dermatologist had made. So after that, means 12/4, she had prescribed antibacterial medicine, antifungal, antihistaminic and anti-allergic, as well as another antibacterial medicine, and some dusting powder for the treatment part, okay. Now on 14th, after 2 days, what has happened after 2 days? The diagnosis has changed now. The diagnosis is now herpes genitalia, okay. So the herpes genitalia is the next diagnosis which is written on the prescription itself, and the content in terms of that antiviral treatment, like, and the neuropathic pain that she is having. Next please, Viraj. So here we can see, when we analyze these things, what has happened to the patient as a person. The dermatologist had made a diagnosis of tinea cruris, diabetologist has given antimicrobial treatment, obstetrician gynecologist has given medicines for menorrhagia, dermatologist has given medicine for candidial vulvitis, and another dermatologist herpes genitalia and the neuropathic pain that this lady is having. Now as a homeopath, we have to deal with all these things, because we are having a holistic concept, patient as a whole, where we are trying to understand the patient in totality, in toto. And the father of diabetologist, Jordan, also believes that the patient has to be understood in his totality, along with the various environments that are there. Next please. So on examination finding, Krutik Shah sir said that no one examines, and I agree with him that it is one of the important part. I still made an attempt that whatever image is there in front of me, I will diagnose on that part. So induration is there, and we can see that it is spreading. Next one. Now what type of disease is this? That is also one of the important part in terms of understanding the evolution of disease and the impact of that disease on the patient. From philosophical point of view, from organon point of view, we have to understand the different concepts that are lying in the case. So the type of disease is complex. Again, going back to organon 36th aphorism to 44, we can find out the complex diseases, concept of complex diseases. Here we are able to see that there are 4 locations that are involved. Endocrine is involved, then the CVS is involved, female reproductive system is involved, and the skin is also involved. Now disease diagnosis. While understanding the prescriptions and the diagnosis that has been done by the different consultants, I was trying to understand that why this lady is suffering. What is the reason? So there are risk factors for developing genital herpes also. So as well as the candidial vulvitis or tinea cruris. So candidial vulvitis is having because of weak immunity. Uncontrolled diabetes is definitely signifying that it is having weak immunity or it is weak response. So that is there. Those who are not interested, they may leave. Please don't disturb. Those who are listening peacefully, let them listen. Okay. So candidial vulvitis, weak immunity and diabetes. tinea cruris is having risk factor of obesity, profuse perspiration and diabetes mellitus. Again, when we make a diagnosis of herpes genitalia, the triggering factor is menses. For herpes, the triggering factor is menses. That is the risk factor that I had identified in different literatures. So, the miasm that we are able to understand, that different medicines have been prescribed, so definitely there is suppression. So location, skin, itching, burning, suppression of skin disease. Now physiological functioning, if we see, the hyperactivity in terms of perspiration is profuse, menses are heavy, profuse, and in terms of the another miasm, that psychosis, where subjective distress is there but the poor response towards the treatment that we are able to see. So that signifies about the psychotic dimension. And in terms of tubercular, where we can find out the uncontrolled diabetes mellitus, so it is a mixed miasm also because of the mixed disease, complex disease. So next one. Now what about the susceptibility and sensitivity understanding? Now definitely the susceptibility is of a mixed nature. Why mixed nature? Because at subjective level, when we talk about mind, subjectivity is high. When we talk about physical level, it is moderate. And when we are dealing with objective, that is the pathology, it is high in terms of uncontrolled diabetes, severe itching, severe burning, what is there. So what does it signify? It signifies that the susceptibility is at high level, at pathology level. So what I felt, to start with moderate potency, review after remedy response assessment. So we will assess it after understanding what kind of remedy response we are getting from this medicine. So general vitality is poor. Therapeutic planning, we should plan what we are able to or what we are expecting in terms of the outcome. So what is the first priority? The first priority is treatment to give instant relief, expected outcome to restrict the pathological progression. That is what we are planning for. Next one. Now this is a poor, this is the in total understanding of patient. I won't repeat it. Next one. Now this is the repertorization sheet, where the psychological theme, anxiety for, fear dark of dogs, confidence, want of self, menses profuse, menses painful, burning at genitalia region, menses during. The general analysis that I found in complete repertory about reaction poor. There is a rubric called as reaction poor, and then the perspiration profuse, female genitalia itching, burning, and the female eruptions. Sulfur calcarea. At the time when I was talking with that lady, I had some my own prejudices in terms of this lady might be calcarea. And when she was talking about sulfur, I was again when she was talking about skin complaints, I was again coming back to the concept of understanding that she will need a multi-miasmatic remedy which will have a wide coverage at the location part as well as at the miasmatic understanding part. So next one. So Boger talks about this remedy in terms of poor reaction and skin won't heal. This is what it is given. So my selection of remedy, as the totality was also matching, and the Mater Medica references were allowing me in terms of understanding that it is dealing with poor reaction, skin won't heal. So on that basis, I prescribed Calcarea Sulf 200. Next slide. This is a dermatology life quality index. Again, we have to run parallelly with modern medicine in spite of blaming them or blaming anyone else or feeling pity about ourselves that we are homeopath and we don't do this and that. So we should follow certain assessment criteria also. So at the initial stage, we had assessed this lady where there are 10 questionnaires where we are able to understand how these skin complaints are affecting the overall life of the patient as a person. And in that, when we are scoring, there are 27 marks. I will just brief you. Next slide. The questions that are there. So this is the scoring method. Very much, a lot, a little, not at all, not relevant. And the score that patient had was of 27, and it means that it is extremely large effect on patient's life. Now what kind of questions are there? Whether the skin complaints are affecting going outside, doing leisure activities, working at home, when someone is at home, whether that is also affecting your health, during sexual activities, during multiple things that we do in day in and day out as a daily activities or activities of daily living. Next slide. So the scale, symptoms and feelings are there, leisure activities, personal relationships, then treatment, work and school, and daily activities. These are the areas which are covered by this dermatology quality life index. Next one. So the follow up is there. One minute, just go back. In that follow up, we can see before it was 27, on next follow up 2914 it is 18, then it became 8, and then it became 0. So let's see next. So the follow up, what does the follow up talk about? Patient was highly concerned about her skin complaints and menses as it had affected her QOL. Allopathic treatment for skin complaints were stopped before starting homeopathic treatment. She reported that her blood sugar levels are within 250 milligram per deciliter, but didn't share her reports even after insistence of its importance in the management of skin complaints. Over a period of time, her menses returned to normal. In between, she had long journey by car. At that time, itching was aggravated, and based upon that totality, R-sub 200 QDS resulted in amelioration of her itching. Next slide. So this was the first follow-up. I hope no one is taking photograph. So at bedtime we had given her Calcarea Sulf 203 pills. The WhatsApp communication is in front of you. Induration has ameliorated. Particulars in terms of eruptions, discomfort, itching, burning has ameliorated. Mental general anxiety has ameliorated. Physical general menses were of 6 days duration. Flow was reduced on 4th day, and on 5th day onwards no flow or spotting was not observed there. There was no spotting. What kind of interpretation we are having as per the Kent's remedy response or 12 observations or prognosis after administration of the remedy? We are able to make interpretation that remedy has acted at all levels. Potency and repetition was correct, and the second prescription that we had thought was of the repetition of the same first prescription. Next one. Next one. नहीं इसके पहले. Just go one slide back. Next. So the next follow up, where she had sent me the HbA1c report, it was 8, and this is the condition. You can easily find out that there is definitely change in terms of induration, and physical complaints were also better. So again we had repeated Calcarea Sulf. Just consider that this is your family member and then do an u. Okay. So now this is the, I think, third or fourth follow up, and she had asked me that thank you once again to be there always as and when and I needed you, thank you. So I said that the skin complaints appears too good, healing is taking place. What about itching? It's there at night mostly, she replied. Okay. So again we continued the medicine. Next slide. Doctor, itching is gone, but healing is as it is at last picks, 24th of May. I said that it is better than the last pick. Thickness had gone, discoloration will go in few weeks. So just continue. And whatever allopathic medicine she had consumed, because of that too much of heat was generated, and she had developed aphthous ulcers as well as stomatitis. So she had mentioned that, but my ulcers in mouth and throat are still there. I said okay, continue medicines as it is. We are not going to change anything. Let it go as it is. Continue. This time call me before taking Calcarea Sulf, as last time she had mentioned, and again the whatever complaints were there in terms of when we had phone talk, she had mentioned that the itching is still there. In mild intensity, occasionally itching is there. So I made it from single dose to 3 doses. Next. So July 24 you can easily make up the change. Next. So this is the last thing. Next. And this is the monarch inventory from research perspective that we should go for, whether it is just a coincidence and whether such kind of results can be reproduced when we are prescribing in similar situations. So the score talks that yes, there is a causal relationship between the remedy, there is a definite relationship, and we can definitely produce such kind of results in such kind of cases where there are multi-miasmatic dimensions are there as well as multi diseases are there, like complex diseases. Next. So what we are aiming, establishing clinical features by history taking, knowledge of disease, knowledge of pattern of disease presentation, and the ability to interpret what patient's clinical database is there. We are able to interpret the data. Next one. This is given in Hutchison. You can go back and refer Hutchison's clinical medicine. That's why purposefully I have taken that. And the working principle or the thought process that we had in terms of anamnesis, like the case record, presentation of disease, integration in man in health and man in disease, the remedy response, and principles and practice based upon the logic of homeopathy. Next. So this is the working model. Process of learning is based upon observations given as per the facts that are available in the Materia Medica. Experience of standardized homeopathic practice, what I have learned in my alma mater and I am practicing at Latur. And correlations with clinico-pathologic concepts, psychopathologic concepts, which is given in Symposium Volume 1 at last. Knowledge will definitely extend at different levels. Next. So acknowledgement to all of you, the organizers as well as the dignitaries, and I hope I have lived up the last batsman's role in terms of dealing with patient in as a whole. Okay. So thank you once again for giving me this wonderful opportunity.